Hi, how you doing?
Wayne Imbrescia never dreamt of success.
Here we go.
He worked for it.
I feel invigorated by it all because the work's been so profound over the years.
The executive director of Ambulatory Services has been pouring his heart into University of Utah Health for 36 years, and everyone who knows him best can back that up.
He was, and is a workaholic. And he'd come in super early and he'd come super late.
It was May 5th, 2021. Wayne was leaving his office at the John A. Moran Eye Center. Due to the COVID-19 pandemic, he says he had developed a route out of the building that stayed out of the public's way.
I got on the service elevator, went down the service elevator, and I was using the elevators because of COVID. The doors open, and then right there's a doorway that goes down a set of stairs to get to the parking garage.
That's when Wayne's journey quickly took an unexpected turn.
It was a sound that just stopped me in my tracks.
Just a few flights down was pediatric ophthalmologist Dr. Griffin Jardine.
And I think I was literally right here at the door when I heard the sound. And I was on the phone with my wife and running late to coach my son's soccer team. I heard a thud that sounded like somebody had dropped a full heavy suitcase down a flight of stairs.
Wayne had just fallen face first down a set of concrete steps in the stairwell, 13 steps to be exact, while walking to the parking garage.
When I saw Wayne's body right here and his legs still partly up the stairwell.
Unresponsive and no heart rate, Dr. Jardine dialed 911.
911, what's your emergency?
I looked at him and I remember thinking, is his neck broken? Can I even move him?
Wayne had just suffered what's called a widowmaker heart attack. His left anterior descending artery was almost completely blocked.
We got him flat, and at this point, he took his first breath, but it was what we call agonal breathing, almost like a reflexive just, and then no breath for 10 or 15 seconds.
Trained in eye care, you could say Dr. Jardine was out of his element, but that didn't stop him from taking action.
Here's where he pulled me down and did CPR right here.
Dr. Jardine started chest compressions.
I don't think anybody in that whole time came down that stairwell.
All alone, he rushed to yell for help. In the time it took for paramedics to arrive, Dr. Jardine never stopped performing CPR.
Just this fear that this was it for Wayne.
They told me I was legally dead for a while.
The clock was ticking, and Dr. Jardine had done all he could. It now was in the hands of the paramedics. After several shocks with the defibrillator, it was one paramedic that said one more try.
I understand one of the paramedics decided to give me a third shock with the defibrillator and got a heart rhythm.
Now a heartbeat, Wayne was rushed to the emergency room, and Dr. Jardine was left with what ifs.
I remember going home, and I went on like a 2.5-hour walk with my wife because I was playing over every single thing that I did. I remember thinking, gosh, did I do this fast enough? Did I wait too long? What did I do wrong here?
Several days later, and 3 stents placed into his heart, Wayne woke up in the cardiac intensive care unit.
I woke up and was confused and asking the nurses and everybody around me where I was at, what was going on.
With strict visiting policies in place due to COVID, Wayne's coworkers showed up by his side when his family couldn't. One of his very close friends and mentor, Dr. Randy Olson, being one of the first.
I remember he came walking in. He was vocal. He doesn't remember any of this. His speech was slurred. Definitely knew where he was.
Then it was the reunion no one was prepared for.
Randy called me and said, Wayne would love to see you. Because at this point he was awake enough. And so I remember going into his room and we looked at each other and we both just started crying. Just because it was so, we just felt like we were bonded to this experience. It was really a miracle.
Wow, how he put his own, needs aside for somebody else in life. He made some choices on my behalf that I'll forever be grateful for.
So you'll take these elevators downstairs, then turn right, and you'll check in down there.
From there, Wayne began his road to recovery. He underwent 4 months of cardiac rehab at the South Jordan Health Center. and learn to follow a heart-healthy diet.
There's a lot of grains, there's a lot of fruits, there's a lot of juices, low sodium. You can't have anything. You're restricted to 2,000 milligrams of sodium a day.
Now, a year later, Wayne's made a full recovery, losing nearly 50 pounds along the way.
I weighed 235 pounds, and today I weigh 180 pounds.
And he's now back to work,
Wayne. Hey.
this time with a different outlook on life.
There's absolutely no question in the communication I've had with my physicians that stress is a big, part of the reason I had the cardiac arrest. When I wake up every day, I make sure I smell the roses, literally, Never would stop to smell flowers in my life. I was always too busy for the things that are now really important in life to me.
He even went back to get recertified in CPR.
I've learned a lot about hearts. I knew a lot about eyes, I knew a lot about healthcare, but now I know a lot about hearts.
Once he got to the hospital, that was a relief in and of itself, because I do have so much faith in the healthcare system here, and that he would be given the best care possible.
A place he dedicated himself for decades has now become a true part of his heart.
To experience it and then see the outcomes of that and live the outcomes of that is profound. I'm convinced we're the best healthcare system in the world, or I wouldn't be here today.
For UView Health, I'm Abby Kirk reporting.